In this video, I'm going to show how to instantly relieve sciatica pain in the hip. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over exercises that can help instantly relieve sciatica pain in and around the hip, even within 30 seconds. And to keep it easy, these exercises are going to focus on the main causes of sciatica in this area, which would be from a pinched nerve due to a bulging or herniated disc and piriformis syndrome. Each one of these exercises works just a little bit differently. They're going to focus on a different cause. So to get the best results, go through them all and use what gives you the most relief. With that being said, let's get started. So here's a series of exercises that's going to be based off what is known as sciatic flossing. Sciatic flossing is great for pretty much taking tension off the whole sciatic nerve pathway from your hip down the leg all the way towards your toes. The first movement, what we're going to do is start seated with very good upright posture. Just have your back as straight as possible. Whatever side that you're having the most amount of pain, let's say it's your right side, straighten that leg out like this, take your heel and just gently press it down into the floor. Press into it slightly because you're going to start to feel a really good activation of the muscles around the hip, including the glutes. So once you feel that, hold that position. What we're going to do next is now put our hips and pelvis into an anterior tilt, which will deepen this stretch. So imagine your tailbone right here. What you want to do is kind of scoop it away and down, so almost like pressing it right down into the chair. As you do this, you're going to feel your hips and your pelvis start to rock forward, but more importantly, a deep stretch form on the back of your leg over the hamstrings on the back of the thigh that works towards your hip. Once you feel it around the hip, you want to hold this one comfortably for about 3 to 5 seconds. You're going to relax and then you're going to repeat this 5 to 10 times. And with each repetition, try to build into it just a little bit more. So the next movement is going to be based off our flossing motion. So for this one, again, whatever side that you're having the most amount of pain, you're just going to straighten that leg, but this time around, just gently rest your heel on the floor. Don't press down into it. You want everything nice and relaxed. From here, we're going to take our foot and we're just going to press it away from us as much as we can, kind of like pressing into a gas pedal. As you do this, you're going to feel a really good stretch form pretty much throughout your whole leg, working upward towards the hip. Once you feel it around the hip, you want to hold this for about a second or two and then go in reverse, bringing your foot and toes back towards you. It's the muscles just a little bit differently. But you're going to repeat this over and over again for about 15 times in both directions. So this is just going to help floss that sciatic nerve. So the last movement is going to be the most intense. This one is called the slump stretch, so build into this one slowly. So what I'm going to do this time around is, again, just have everything nice and relaxed. I'm not going to press my heel into the floor. Let's bring our foot and toes back towards us as much as we can until we feel that light, gentle stretch throughout the leg and also around the hip. We're going to hold that and now we're going to slump forward with our shoulders. So round your upper back and just slump forward, bringing your shoulders and your chin right here towards your chest. As you do this, you're going to feel a deep stretch. I pretty much feel it on the outside of my calf that's working upward towards my thigh, but I also really feel it around the hip. Hold this one comfortably for about 3 to 5 seconds. You're going to relax and then repeat this 5 to 10 times. And again, with each repetition, just try to build into it a little bit more. If you would like to take the slump stretch to the next level and get a lot deeper stretch, what you can do is, instead of keeping your foot on the floor, raise it up just like this. And you can also use your hands on the back of your thigh to help support this movement. But you want to bring your toes back towards you until you feel that light stretch, and then you're going to slump forward. But progress into that one only when you are ready. But go through all 3 of those movements. You're probably going to find that one just helps you out a little bit more. And at that point, I would throw more repetitions in, and it's a great exercise that you can use throughout the day. So here's a really good exercise that you can do standing that will quickly take pressure off that whole sciatic nerve pathway around the hip. It's called the step back. And if you've never done this one before, I would recommend doing this next to a wall or having something that you can grab onto for support. So what I'm going to do is start in a scissored stance just like this with the painful side towards the back. So I'm going to demonstrate what to do if you have left-sided sciatica. Let's take our front foot and turn it inward as much as we can until we feel a really good activation of the muscles around the hip, including the glutes and the piriformis. We're going to hold that and now do the same thing with this back leg. At this point, you should feel all the muscles around the hips start to fire, but this is how we're going to intensify it. We're going to slowly just lean backward with our body weight, placing it all on this back heel. Keep leaning into this one because you're going to feel those muscles really start to fire. And once you feel that, hold this comfortably. If you do start to feel any more pain or discomfort, just lean forward a little bit to the point where it is just a comfortable activation of these muscles. But this is how we're going to take it to the next level. We're going to put our hands right out in front of us, just like this, kind of like a genie position, and we're going to slowly rotate through our lower back and our waist towards that painful side. And as you do this, again, those muscles are going to activate more and more. Once you feel a deep, comfortable stretch, you now want to hold this for about 20 to 30 seconds. You're going to relax, and then you're going to repeat this 3 to 5 times. And with each repetition, just try to build into it just a little bit more. Afterwards, see how you feel. If it's really helping out, you're more than welcome to throw in another repetition or two, and it's a great exercise that you can use throughout the day. This exercise is going to focus on a major cause of sciatica pain around the hip, which is piriformis syndrome. That's when the piriformis muscle compresses the nearby sciatic nerve, leading to sharp-shooting pains in the hip and across the buttocks. For this one, we're going to lie flat on our back in bed or on a floor. Have your legs roughly hip-width apart, knees bent, feet flat. Take your hands, put them off to your side for support. So the first thing that I'd like to do is just get everything warmed up and bring some really good blood flow in. So what I'm going to do is just take my heels and gently press them down into the bed or the floor until I feel the muscles around the hips start to engage, just a light engagement of these muscles. From here, what I'm going to do is slowly lower my knees and legs downward towards one side, but I'm going to try to keep my back as flat during this movement and move through my hips and through my pelvis only, because you're going to feel a really good stretch form around the hips. Once you feel that, hold this comfortably for a second or two, and then you're just going to go towards the other side, kind of like a windshield wiper. And just keep doing this over and over again for about 10 to 15 repetitions. And with each repetition, try to build into it just a little bit more. So from here, I like to target the piriformis muscle a little bit more. Whatever side that you're having the most amount of pain, let's say it's your right side, take that side's ankle and place over your other side's knee. So when you look up, it should look like a figure 4. From here, we're going to take this bent knee and just slowly press it away from us, but don't use your hands. Instead, use your leg and hip strength. The more that you press away, the more that you're going to feel a deep activation of the muscles around the hip, including the piriformis. Hold this comfortably for about 5 seconds. You're going to release it, and then you're going to repeat this 10 times. And again, with each repetition, try to build into it just a little bit more. If you would like to get a deeper stretch into the piriformis, this is what you can do. Instead of taking your knee right here and pressing it away from you, just have it nice and relaxed. Take your hands and go through the opening created by your legs and grab the back of this back thigh right here. And what you're going to do is just pull this back leg towards you, kind of like bringing your knee towards your chest. But build into this one slowly, because you're going to feel a deep stretch form across your glutes into the hip. Hold this one comfortably for about 15 to 20 seconds, release it, and then repeat this 3 to 5 times. And again, with each repetition, try to build into it just a little bit more. But if you would like to take this one to the next level, what you can do is add in a rocking motion. So let's get back into our deep stretch, hold this, and now rock our hips towards the non-painful side. So I'm just going to rotate my legs towards my left side. You're going to feel a deep stretch form. I pretty much feel it from the back of my thigh working into my glutes across my hip. I'd like to hold this one for about 5 seconds, relax, and then repeat this about 10 times. And with each repetition, just building into it a little bit more. But go through all of these movements. You're probably going to find that one just offers the most relief. And at that point, throw more repetitions in. This exercise is called the McKinsey Lean, and it's perfect to use if your sciatica pain in the hip is being caused from a pinched nerve due to a bulging or herniated disc. For this one, we just need something that we can lean into, so a door frame, a wall, or a door. With this one, the hardest part about it is just knowing what side to place towards the door frame or the wall. So remember, good side or non-painful side will face towards the door frame. So to get into position, we're going to place our feet together, spaced roughly a foot, foot and a half away from the door. From here, I'm going to lean my body weight into the door frame so my body is slightly tilted, just like this. And during this exercise, you want to make sure that your arm and your shoulder are flush against whatever you're leaning into. So there should be no space like this. Instead, all movement is going to come through our hips, through our pelvis. So I'm going to take my hand, place it right here on that painful hip, and now I'm going to slowly press my hips towards the door. Do this one slowly because you're going to feel a deep stretch form in your lower back that works downward into your hip. With this, what it's focusing on doing is taking pressure off this bad side and placing it towards the middle. So it's effectively unpinching that nerve. And what we want to see is what is called centralization. In a nutshell, when you put pressure onto the sciatic nerve, it causes pain to shoot downward. When you take that pressure off, it centralizes, or it comes back up towards the lower back. So as you do this, if you notice your pain is going from your hip to your lower back, that's a great sign. But if you do notice more shooting pain going down into the hip, possibly even towards the thigh, back off because this one is probably not for you. But go towards a light, comfortable stretch. Hold this one for 20 to 30 seconds. But if it does feel good, you can hold it for longer. From here, you're just going to relax and then repeat this 3 to 5 times. And with each repetition, try to build into it just a little bit more. If you would like to deepen this stretch, all you have to do is move your feet further away from the door frame. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.